As many of you know, the HPA axis is a vital network involving the brain's hypothalamus and pituitary gland, and the adrenal glands. This system plays a central role in managing the body's response to stress and regulating various bodily functions through the production of cortisol. Glucocorticoids are powerful medications frequently used in veterinary medicine to treat a wide range of conditions, including allergies, inflammation, and immune-mediated diseases. These drugs mimic the effects of cortisol and can be very effective in alleviating symptoms. However, a well-known consequence of administering glucocorticoids is the suppression of the dog's own HPA axis. When the body receives external glucocorticoids, the natural production of cortisol can decrease because the hypothalamus and pituitary glands sense sufficient levels of these hormones in the bloodstream and reduce their stimulating signals to the adrenal glands. Understanding how long this suppression lasts after stopping glucocorticoid treatment is critical for veterinarians, especially when diagnosing other conditions like hypoadrenocorticism, also known as Addison's disease, where the adrenal glands do not produce enough cortisol on their own. Diagnosing hypoadrenocorticism can be challenging because its clinical signs, such as lethargy, vomiting, weight loss, and decreased appetite, can be quite general. The ACTH stimulation test is the primary diagnostic tool for this condition. This test involves measuring cortisol levels in the blood before and after administering a synthetic form of adrenocorticotropic hormone, or ACTH, which normally stimulates the adrenal glands to produce cortisol. In dogs with a healthy HPA axis, the cortisol levels should rise significantly after ACTH administration. However, if a dog has recently received glucocorticoid treatment, the suppressed HPA axis may not respond appropriately to the ACTH, leading to what is known as a false positive result for hypoadrenocorticism. This can result in a misdiagnosis and inappropriate treatment. This study provides valuable data on the recovery of the HPA axis in ill dogs after treatment with intermediate-acting glucocorticoids. The findings indicate that while most dogs recover relatively quickly, within a few days to a couple of weeks, a notable subset can experience prolonged HPA axis suppression lasting more than 8 weeks. This prolonged suppression can lead to false positive results on ACTH stimulation tests and potential misdiagnosis of hypoadrenocorticism if testing is performed prematurely after stopping glucocorticoids. Therefore, clinicians should be aware of the significant individual variability in HPA axis recovery times and consider this when interpreting ACTH stimulation test results in dogs with a history of glucocorticoid treatment. Waiting an appropriate amount of time and potentially performing serial testing in cases of uncertainty is crucial for accurate diagnosis and management.